Hello, everyone. Welcome to the Culinary Medicine Interest Group podcast. With us today, we have Dr. Wilson, the FCM course director at NYMC. I'm going to have her introduce herself briefly.
Thanks, John. For everybody, my name is Dr. Jeanne Wilson, and I am a general pediatrician. I've been in practice for about 30 years now, in primary care, and my practice has always been local here in our community. And currently, I'm also the medical director for the Mount Pleasant Central School District. Happy to be here today.
Yeah, thank you so much for coming on. We're really excited to have you here too. And so for everyone listening, one of the things that we're really interested in talking about today is the topic of childhood overweight and obesity. As many people might be aware, the rates of childhood overweight and obesity have nearly tripled in the last decade. And although we have seen some plateau in the rate of increase, the number of both children and adolescents who are affected by childhood obesity and the related comorbidities is still growing. And so we thought this would be a really interesting topic to discuss with a pediatrician and to get your take, Dr. Wilson, on this topic. So I guess to kind of start us off, as one of, if not, the first line of contact for children and their families, as primary healthcare providers, how do you feel that your role as a pediatrician, helps to address the prevention of childhood obesity with your patients?
Yeah, so that's a great question. It's very interesting what you actually first just brought up about there might have maybe is some plateau in the rate in the past few years that have been observed. I'm really curious to see how honestly COVID has affected this. It sort of changed the dynamic of everything. I really kind of look forward to that data comes out, if that plateau is still a thing, or if it's sort of, gone on the increase again, which is where I'm sort of thinking it is. But to answer your question, I think mostly through education, efforts that begin in the prenatal period, when we target the behavior and the diet of the mom, and then carrying this education through the postnatal preventive efforts that target infant factors that are linked to early weight gain. And some of these factors actually can be things like infant feeding mode, whether they're breastfed or bottle fed, infant sleep duration, where very often parents, when babies will wake up at night, parents will automatically go to feed them instead of trying to have them self-soothe if that's appropriate, or other forms of soothing them. Parental use of food to regulate infant distress. So even during the day, if a baby's crying, everybody sort of assumes that they're hungry all the time. And then, of course, the timing of the introduction of solid foods and table foods, as well as the introduction of sweetened beverages, like things like juice and whatnot.
Thank you for sharing. It was very interesting to hear, especially what you just said about infant feeding. I think that's a really interesting point that people don't really think about all that often. I know the number of times I've heard when a baby's crying, someone says they must be hungry, and that's just the instant reaction that we all have.
Absolutely, yes. Especially, it is very important to feed a newborn on demand, which can be every hour to every 2 hours. But the older they get, and also depending if they're breastfed or bottle fed, there is some time that can go by. So before you actually need to feed them, and maybe they just have a little bit of gas, or maybe they're just need a diaper change or something. So it's not always immediate hunger that's going to lead them to start crying.
It's a very interesting and useful point. Thank you for that. Something that we wanted to ask you about next is kind of tying into obesity as a whole. It usually carries a vast degree of comorbidities, especially in the adult range, but also in the pediatric age range. What are the most common comorbidities you see in the patient population that you see, particularly pediatrics, and why is it important to address obesity and overweight at an early age rather than letting it progress to adulthood?
Yeah, so interestingly, now we're seeing a lot of younger children with sort of metabolic abnormalities in terms of things like elevated fasting serum glucose levels or hyperinsulinemia, insulin resistance, elevated triglyceride levels. So this all sort of, rotates and evolves around the impaired glucose metabolism. And that's something that's really, we hadn't seen a lot of that in the past in kids. That was always an adult disease. And also things like actually systolic hypertension are also on the rise in kids as they become obese, in terms of having their elevated BMIs. So, and honestly, even kids who are not strictly obese, maybe even in the overweight category, which usually is like the 85th percentile in terms of their BMI, are also at risk for these comorbidities. And not only does it tend to cause metabolic and quote unquote medical problems, but can also lead to a lot of social problems beginning in childhood, even younger and very early on in childhood. And these can then evolve and become, things like, in terms of like obstructive sleep apnea, low self-esteem, even depression, and overall just decreased mobility. So it's not only things like type 2 diabetes that kids can go on to develop at a much younger age, and cardiovascular disease, but also some other things that I just mentioned. So, yeah.
Yeah, I think that's a great point. I think a lot of times when we, hear and we discuss obesity as a whole, we think of, the physical effects, and we talk about obesity as a physical condition. But as you've been mentioning, there's so much more that goes into it, and there's, the social aspects and the emotional aspects, and how a child, grows up as a whole, and the environment that they're in. There's so many different effects that play into it. And I think it's so important to have recognition about that.
Yes, absolutely.
Speaking on your point, you were talking about a few of the metabolic comorbidities that we see. Something that I know that we've been seeing a lot more, and it's been discussed a lot more in medical practice, is the issue of early onset puberty in a lot of this population. Can you speak a little bit more about this, and if you've seen this in your own practice?
So I would say, yes, I have absolutely seen the onset of earlier puberty in overweight and obese girls. And that can honestly then go on to lead to, the earlier puberty hits, the sooner that their growth is going to stop, because the growth plates are going to fuse. So that's definitely a side effect of having earlier onset puberty in girls. I honestly don't know, and some of the research that I've read in terms of boys, I think it tends to actually have puberty onset later in boys than girls, which I always think an interesting thing. And so I'd have to say, just even in my experience, I definitely have seen earlier onset in the girls, but not so much in the boys.
Yeah, that's very interesting. Thank you for sharing.
Oh, no, I think, and it's something that absolutely has to be looked at in much greater detail, because there really isn't any direct evidence in either way. So it's just something that's an ongoing project that's looked at.
Probably some interesting research to hopefully
Yes.
come in the next few years. Kind of on this topic of of growth and weight. There's a lot of conflicting thoughts about encouraging weight loss versus encouraging the aspect of helping a child grow into weight. I don't know if you've ever talked about this in practice, or if you have any opinions on how the mindset and the way that we talk about weight with children, and how this comes into play.
Oh, sure. Yes. Definitely. I have thoughts on this. So honestly, all other factors aside that contribute to weight gain, and honestly, many of which are really beyond the control of a child, because there's so many outside factors that influence this. To me, the idea of telling a child or an adolescent that they have to lose weight for the benefit of their health, it can be a slippery slope. Kids very often don't feel that this is an issue for them, and they may not want to be told what they need to do, especially if it's something that they're not necessarily agreeing with, or want to stop eating their favorite snacks, for example. So this can set up. So if you take that approach, it can set up almost an adversarial relationship between say the provider and the child, and in some cases, even between the child and their caregiver, especially if the parent is really focusing, pretty much hardcore on the fact that their child has to lose weight, and their child is just not interested in that, and can be even sometimes feeling like they're being punished for something in terms of being overweight or obese, or they have done something wrong. And this can go on to even, I think, spur some guilt in this area. So when I'm talking about this with families and kids, I sort of like to take a graduated approach, especially early on in my conversations about what a healthy weight looks like and how do we get there. And I often refer to like the pediatric growth charts with the caregiver and the child, and a way to sort of illustrate where their child is now on the growth, like the BMI growth curve, and what if we stay on this trajectory, where they may end up. And usually that's going to be in the 95th to 99th percentile, which is technically obese. So I find that sometimes if we sort of take that approach and then say, okay, so if we, instead of looking at the trajectory, the current trajectory, if we try to focus on maintaining our weight, what would that look like over time on the growth chart? Because children will over time also grow in height, so that can help even out things a little bit. And so this sometimes gives them a feeling of a little bit more control, that we can definitely take some steps to shift our lifestyles and some of our dietary changes to toward a more healthy weight over time, and that can be reflected in the growth charts. So I think sometimes that really is very, very helpful. But the question then, honestly, is how do we do this? We know that every single patient is a unique individual, and they all come, like we're talking about, with a complex social and personal history. So it can be challenging. So to me, this is a great opportunity to really appreciate the idea of continuity of care. A pediatrician like myself, who's been working with families, the same families for a very long time, having the privilege of taking care of these kids for so many years, I can also have insight into the family dynamics that I've seen over many, many years. And this can be helpful in saving time, as well as trying to come up with a care plan that can work for everybody. It's also a great opportunity to incorporate things like telehealth visits, because parents, actually are really, really have taken to these telehealth visits throughout the COVID pandemic, and it gives the parents some flexibility and the patient the flexibility to not have to come into the office if they don't really want to, and can also open up the doors for many other providers to be involved, like nutritionists, for example. So I hope that answers your question.
Yeah, no, I think that was a very well-rounded and a great answer to it. And I think what you were talking about showing the growth chart, I think there's such value in sometimes giving, like visible, tangible ways to show people, as opposed to, lecturing, which is what I think a lot of people think, when they come to, a physician, that they're going to get lectured at for something. But really what we want to strive for, as future physicians, and as, people listening who maybe are current physicians, is really forming that partnership with, a patient and families, and that longevity in care, which I think is so invaluable. And going off of your point in telehealth, I would love to hear your perspective. And I think you've touched on this a bit, but I think, with our day and age, there's a lot of technology, there's a lot of misleading information, but there are also a lot of companies and organizations and even healthcare centers who have tried to target, I would say, pediatric overweight and obesity and weight management through different apps and systems in that way. And I know there's a lot of controversy behind things like, red, yellow, green light. And I know that we all have our own personal opinions on it. And I would love to hear if you had any opinions on this and its efficacy.
So yes, I think a lot of it has to do with what we're talking about in terms of which particular apps or even weight loss programs, for example. To me, a person's relationship with food overall, I think is something that's really overlooked in pediatrics, especially. and like I said before, telling somebody they have to lose weight if they're not invested is really going to be frustrating for everybody. And so that's when sometimes we'll try to bring in these other ways and other methods and technology programs to sort of help us, get a kid or excited about it. But that doesn't always work, because I really think sometimes can be like sort of leaving them out there alone with an app to sort of figure this out. And that to me is not the best way to go. I think a multidisciplinary approach is really, really important, where you have sort of in-person and online approaches to this combined. And so that it gives the kids a chance to feel supported, to have, successes acknowledged, to work with with maybe some of their peers, to kind of find out what works for other folks. And to get some advice from experts, and also include the family. This is not something that you can just, here's an app, count your points, or, hit your, like you were saying, green, yellow, red targets, and just look it up on your phone and you'll be successful. It is so not like that. And I know kids love technology, but it just, that won't work. So you need to involve other people, peers, family, and you cannot do this without family support. So there are some, some good programs. I think I'd rather call them programs than apps, because personally, I think just an app in and of itself is not helpful.
Yeah, I think that's, all wonderful points. And, I couldn't agree more with everything that you're saying. And it ties back into everything we've been discussing about, all these different multidisciplinary and all these different, factors that go into, a patient's life, and the importance of mindset and, cultivating a healthy relationship with food. And something like red, yellow, green can sometimes, make patients feel like, if this is red, I can't have it, or, I won't have it. And then when they see that red food, suddenly they want more of it. And all those things that can come to play after. But I agree with technology comes a lot of benefits, and some areas that may be not so beneficial, but I think there's so much potential to, like you said, have ways where we can increase access, which I think is something really important, and also increase communication and interprofessional care, which I think is, something that we're taught a lot, especially with our medical education.
Yes, you're absolutely right. And again, to your point, I think people then tend to develop it, like you're saying, an unhealthy relationship where they start to think of food is the culprit and food is to blame for this. And instead of trying to sort of redirect their knowledge of food and how it can help them, it just becomes something that they just don't want to think about. And then they tend to either just not, in extreme cases, not eat anything at all, or just sort of throw up their hands and eat whatever they want. So, and especially in kids, it's a tricky thing.
Yeah, absolutely. I really appreciate this perspective of looking at it from the area of mindset. And I think a lot of what we've talked about, both in our conversation about these healthcare apps and methods of helping tackle childhood obesity, as well as our other conversation about other questions, kind of ties into the fact that obesity in general, but particularly pediatric obesity, is very multifactorial in terms of how it comes about. And I was hoping that you could comment on some of the different factors that you see, as well as ways that we as medical students can kind of prepare ourselves to be able to tackle obesity, both in pediatric patients and as a whole, from that multifactorial aspect, rather than only targeting the one thing that is simplest to look at, which is food.
Yes, that's a great question. So, and this applies to adults as well as children. The reason people become overweight and obese is because they're taking in too many calories and not expending enough. So really, it's looking at their food patterns, in terms of what they're eating, especially fast foods and processed foods from the food aspect, but also taking into account things, like their activity level. Are they leading very sedentary lives, watching a lot of television, playing a lot of video games? And also that involves a lot of snacking very often, and not very healthy snacking. If you're sitting there watching Netflix or something, or you might gonna grab a bag of chips, and some soda or something like that, as opposed to thinking about maybe, changing just that small change by, trying something, I don't know, like carrots or something, if you like that. But so I think that that's a really, really important thing to realize in terms of this multifactorial approach. It's not, those are two of the main ones that I think about very often, and how they sort of roll together, but also, the other aspects about family situation and the cost of healthy food and access to healthy food and all of that, goes into it as well. And that's why taking, a multidisciplinary approach is so, so important.
Yeah, thank you. I appreciate that last comment too, because that's something that I was thinking about as you were speaking, especially it's more of a area specific issue depending on where you're at. You may see more patients that have this lack of access to food. We know we've learned a little bit through our programs at NYMC about food deserts and food insecurity, and it may be more prevalent in certain areas than others, but it's a very important thing to talk to your patient about and their access to an understanding of what exactly constitutes healthy food. And I think that's a big factor, especially in the pediatric realm, because there also may be that, early stages of education haven't really reached what are good food choices, what is moderation, all of those things that go into building a healthy diet.
Absolutely, yes. I think not only, and food deserts are absolutely an important thing to explore and to investigate. As but I also think nowadays that was something that's really sort of taken hold in the pandemic, is people doing sort of online ordering for their groceries. And so for me, even if you don't have a grocery store maybe down the corner, you still might be able to order your food online and have it delivered. But at the same time, that doesn't take into account the cost of the food. In general, we know healthier food costs more. So even if you have access to a store, be it online or physical building, it's also the cost that goes into it. It's cheaper to buy things that are processed and have extra sugar and the trans fats, because those also taste good. So people will buy them. They're, as we know, they're not very healthy for you, but to get fresh fruits and organic fruits and vegetables can be very costly no matter how you purchase it. So I think that's also, to me, that's the bigger problem right now, is cost.
Yeah, and I think that's a very good point, and we see this all the time, and especially I think being from New York and in New York City, as a whole, and in other cities across the U.S. and beyond, where the convenience factor as well, what they have at the school, what's in the vending machines, what's being offered in the cafeterias, what's on in the convenience stores around the corner, what is affordable. And then I think with that there comes the connotation, as John was mentioning, of what is healthy. And when a lot of the times through media and be it what it is, we kind of see this idea of healthy food must be organic, healthy food must be a superfood, healthy food must look a certain way. And I think something that we as an interest group and as a concentration as a whole really want to explain to people is that healthy looks different for everyone, and healthy doesn't have a one size fits all, and healthy can encompass shelf stable items. Healthy can encompass frozen foods, and and it doesn't have to be expensive, and health can taste great but also be conducive to your health as a whole as well. And I think that's something that's very important to discuss with patients, and try and meet them where they are at, and help them in the ways that we can.
Absolutely, that is very well said. And a lot of people also need to, I think, incorporate cultural differences in these conversations, and that can sometimes be very challenging for providers, because we all come from different backgrounds and we have different experiences and different exposures and work in different patient populations. So for me, that aspect of it is really helpful, to actually just take some time and learn from your patients and talk to them about what food means to them, and what foods are very important in their culture, as well as community leaders. it can be incredibly helpful to sort of reach outside the exam room or the patient center itself and get a lot of great information from community leaders, just about the people that they help care for and they're involved with.
I think that's an excellent point that really rounds out what we're talking about here with the multifactorial aspects of both where obesity comes from and also how to manage it from the perspective of, excuse me, us as the providers. That it comes down to a lot of different things, including but not limited to socioeconomic and cultural factors. And I think you've done a really good job of portraying that. And something I wanted to ask you on that note is, what's your experience been with patients when trying to talk to them about diet and talking about dietary changes, keeping in mind these things that we've talked about with socioeconomic factors and cultural differences between patients and providers?
Sure. Yeah, that's a great question. So as I mentioned, for me, exploring those cultural things that are culturally important to patients really is, for me, a great place to start, because I can write a prescription and say, here's your 1,500 calorie diet and do this and come back in 2 weeks. But that's not going to help anyone. It's not going to be a success in most cases, and that's very frustrating for the providers, for the kids and the families. So to me, it's all really about asking and exploring how we can make changes, very small changes, and it doesn't even necessarily have to be in terms of a specific dietary change. It can be a lifestyle change, and it very, very small. And I often start by asking the patients, great, let's work on this together. So if you had to pick one thing that you might be able to do with the goal in mind of trying to get a better handle on your exercise, or think a little bit more about what you're eating. And again, you have to also be careful, I do want to say, with keeping in mind the age and developmental stage of your patients, right? You talk to teenagers differently than you're going to talk to a 7-year-old. But that being said, you want to include them in the conversation, educating them as well. Sometimes it just by talking to them about what some of the food additives are, or what the difference is in the different types of carbohydrates are, or the fats, can be really interesting for some people, and they just didn't realize it, and then they're willing to have a conversation. Wow, how can I work on that and make that better? So at that point, that's usually when I'll start to have the conversations about, well, I want you to help me help you. So what changes can we make? If small change that we're going to follow up on in 2 weeks, again, either on the phone, through telehealth, as opposed to just writing a prescription and giving a plan and saying go see the nutritionist, kind of let them handle it. I really don't think that that's going to be successful either. Again, and this is in my experience. So it's something that you want to take baby steps with, and have a lot of positive reinforcement and celebrate the successes, and be willing to make changes and start over. This clearly isn't working. So what can we do in all areas, not just diet, but exercise and whatever else is they're focusing on, the other issues that could be causing them to want to eat too much junk food because they're stressed or upset or whatever it is. So again, it's very, for lack of a better word, we keep saying multifactorial.
Yeah, and I think you touched on a really important point, kind of about responsibility and us, as future physicians and physicians in general, where that line is. And I think something that's that we try to talk about a lot, and that we really hope to inspire other future physicians with our interest group is the idea that knowledge is in all different areas is so important. Like you talked about too, going into your community, learning about your patient population, learning about the demographics and the cultures of your patient, learning about their food choices, learning about what's available. I think it's so important in order to offer, very well-rounded care. And I think, like you said, it's very easy to say, go speak to a dietitian, here's a referral. But there's so much value in being able to, talk to your patients about nutrition and food. And if you refer them out, being able to follow with them and having that intimate knowledge of how you can help your patient in all these different areas, like you said. And I think there's so much value in that as well. And on that note, I know that, within our own medical education with the Foundations of Clinical Medical Medicine course, we're starting right now to have a little bit of lifestyle medicine training, and we would love to get your opinion on the importance of incorporating more nutrition education into medical school curriculum, and not just nutrition education, but lifestyle education, and where you feel that's accomplished most effectively.
Yeah, that's a great question. Yes, I am all for it. I think it is, it takes into account so many different aspects of a person's life, their nutrition, even things like who you eat with, and who's preparing your food. So you could get such an incredible insight into someone's life just by talking about their diet. So I think learning how to take a really good dietary history and practicing it often in all different kinds of circumstances is really the first step. Then sort of to what we've been talking about in much of our conversation, getting out into the community and taking some of this information and see what it really means then by talking to real patients. So, we practice in our small groups, we practice with our standardized patients, and, but it's just not the same as having that give and take with a patient in a real community setting and trying to explore all the different aspects of their life, which will then in turn influences so much of what they do in terms of their lifestyle choices and all the choices that they make. So I think it's the techniques and the ideas that we want to sort of put forth in these lifestyle sessions need to start earlier. And not necessarily in the very beginning of medical school focus so much on the medical aspect, but really just about getting a good history and just always sort of taking it to the next level and digging deeper until you feel you can almost live in that person's shoes. And then you can very often find a place that might be an area where you can start to investigate with them to make a small change. And I think that goes a long way because then it shows that you're hearing them, that you're trying to be empathic, and really want to help, but help that is geared toward them and meaningful for them and not so much for you, just so you can check the box and say, we discussed weight loss.
Yeah, I mean, absolutely. And I think that's a great point in terms of, getting a better history and getting a more comprehensive history is something that we're always developing even beyond. I know I'm only in my second year of medical school now, but every time I take a history, I think of something else that I want to talk about. And I think the more that we develop that and practice it, the better we can get at touching on all these different aspects of a patient's life. And that's a great way that we can help with our classmates and medical students in general in terms of how to tackle these various health issues, not just obesity, but all the other topics that we've talked about in these podcasts. It all boils down to figuring out what's the patient's diet like and how can we learn more about their life from it.
Exactly. I do have to say, though, the video that you guys put together is stellar. It's a great place to start, and I look forward to using it over and over again.
Well, we really appreciate that. So to wrap up, we do have one more question we want to ask you. It's more of a fun question that we ask all of our podcast guests. If you were going to present a dish on MasterChef, what would be your signature dish and why?
So I'm going to say I really don't have a signature dish, okay? But what I have been trying to do, and I don't know if this really answers your question, but I think it's kind of fun too. My son's fiance is a vegan, and so we have been trying to incorporate more vegan vegetarian choices in the staples pretty much of our diet as a family. So things like vegan ricotta cheese in one of the foods I make all the time, like a baked ziti, because it's easy to make, you stick it in the fridge, but trying to use better ingredients. And so that's been a lot of fun exploring that. And including for Thanksgiving coming up, we're actually going to try and make vegan stuffing, which is really going to be a challenge because my grandmother's stuffing was nothing but bread and butter. So yeah.
I love both of those answers because baked ziti was always a staple of my childhood, and stuffing is probably my favorite food on the planet. So I'll have to ask you after Thanksgiving comes by how they turned out.
Yeah, I'll let you know. It's fun though. It's really fun. So, and the baked ziti is not bad at all. I'm not a really big fan of the cashew mozzarella cheese, but the vegan ricotta out of the tofu is, I love that. That's great stuff. I don't think I'll ever go back to whole milk ricotta or ever again. So,
All right. Well, thank you very much, Dr. Wilson, for your time and for having this amazing conversation with us. It's incredibly insightful. We really, really appreciate it.
oh no, thank you. It's fun talking about things that are so important to me. So anytime, and thank you guys for really taking this interest group so seriously and doing such great work. I just can't wait to see what you're coming up with next.